My name is Monica Bryant, and I'm a cancer rights attorney and Chief Operating Officer for Triage Cancer, a national nonprofit that provides free education on the legal and practical issues that can arise after a cancer diagnosis. And today, we're going to be talking about Medicare. Medicare is the federally run health insurance option for individuals who are over the age of 65 or for people under the age of 65 but who have been receiving Social Security disability insurance for 2 or more years. Although we talk about Medicare as if it is one thing, it is actually a couple different things because Medicare is divided into different parts, and each part of Medicare covers different services. Part A is hospital insurance, and that's going to cover typically inpatient care when someone is in the hospital. If you've worked and paid into the system, Part A will be premium free. Part B is medical insurance. So that's going to cover things like doctor's visits and immunizations, IV chemotherapy, durable medical equipment. Even if someone has worked and paid into the system, there is a monthly premium for Part B. There is an annual deductible, and there is an 80-20 cost share. Part B does not have an out-of-pocket maximum. So even once someone has met their annual deductible, they will pay 20% of their healthcare costs for the rest of the year. Jumping over to Part D, which is prescription drug coverage. These are plans sold by private insurance companies, but have specific rules around coverage related to Medicare beneficiaries. With Part D, the costs are going to vary from company to company, and there is an annual deductible. The cost share is also going to depend on how much someone's prescription drugs have cost. So for someone, they could have 3 different premiums, 3 different deductibles, and 3 different cost shares. There is an alternative to that found in Part C, otherwise known as Medicare Advantage. These are private companies selling Medicare Advantage plans that bundle all of the services that someone gets under Parts A and Parts B, and typically also includes prescription drug coverage. The major upside to these Advantage plans is that they do have an out-of-pocket maximum, and that out-of-pocket maximum changes each year. The major downside to these Advantage plans is that they are going to have a network of providers. And typically someone has to stay within that network of providers to receive coverage. Parts A and Parts B, known as Original Medicare, is what's called fee-for-service, which means someone can go to any provider around the country and receive care. So there are certainly pros and cons to each option, and someone should be sure to weigh their options very carefully. Triage Cancer has a worksheet that is available for free and linked below that helps you do the math to figure out which of the 2 options makes the most sense for you. I will also say that things change pretty frequently with Medicare coverage, and we have an upcoming change related to the costs of prescription drugs. So starting in 2024, the costs will be capped at approximately $8,000. So that is the most that someone is going to pay out of pocket for their prescription drug coverage. Then starting in 2025, that cap will be further reduced to $2,000 for prescription drug coverage. So stay tuned as those changes are implemented over the next couple of years. Thank you for watching. Be sure to tune into the rest of our How Do I Insurance video series for more tips on picking the right health insurance for you. And for more information on health insurance, please visit the link below.